Okay.
He may not speak the same language as Dr.
Yeah,
Anna Banerjee,
so it's Ahmed and Mohammed, right?
but compassion has a way of transcending all barriers.
Okay.
This diagnosis is a common one.
Okay, so he has, Mom, he has infection in both of his ears, which is not surprising after his viral infection last week, and I'm going to put him on some antibiotics.
Hundreds of refugees started arriving at this Toronto hotel 3 weeks ago. There was no plan to provide pediatric care here until Banerjee stepped forward. She's a medical school professor, infectious disease researcher, and already had a busy schedule seeing patients. But within just a few hours' notice, she started examining sick children out of this storage closet.
There was just a table, and we brought in our portable table and the hand sanitizer and a few other things, and we just started to work. So they gave us this space.
Banerjee is now using a pair of hotel suites. The supplies are borrowed, donated, or her own, all to take care of children who keep coming through her door.
It's been absolutely crazy, and I've been working late hours, morning to night. I've been coming in on Saturdays, just trying to make sure that things get done. I've been ignoring my family.
Viral infections are common, so are parasites and malnutrition. Dental decay is so bad, some children are in constant pain. And then there's the psychological trauma.
There's been kids whose houses were bombed and they were running for their lives, and they sometimes pee the bed, right? You know, it's understandable when you've been through that kind of trauma and you go from place to place and there's so much instability in your life.
I asked, they said we can.
Banerjee gets Arabic translation help from a pair of doctors from Dubai. They can't practice medicine in Canada, so they've jumped in as volunteers.
So this is typical, like we can't get the medications to a kid that has strep throat, so you know what? I'll go pick it up myself, you know?
Banerjee has worked in challenging environments before. In Haiti, she was the chief of pediatrics for the Canadian Red Cross after the earthquake hit. But treating Syrian children here at home has been surprisingly tough.
It's okay?
It's okay.
It's okay.
Banerjee is going to examine a 2-year-old she's had to quarantine in his family's hotel room.
Any runny nose, sneezing, coughing?
This boy has been exposed to chickenpox. Like many refugee children here, he's not immunized. Vaccinations are set to begin this week, but Banerjee says it may not be soon enough to prevent a hotel-wide outbreak. In just 3 weeks, Banerjee has treated more than 200 Syrian children. Their lives are already changing for the better.
When I first came, a lot of the kids were very sick. They had fevers, they weren't playing, they were jet lagged and I think a little bit traumatized. And now you see their kids playing, you know, and once you have kids playing and kids seem happy, they're laughing, you know that they're already starting to adjust.
And soon they'll be moving out of the hotel and getting their own family doctors. Until then, Banerjee won't stop.
We're all falling by the seat of our pants, and we're just, you know, trying to do whatever it takes to get things going.
Vic Adopia, CBC News, Toronto.